When you're first diagnosed with prostate cancer, it's not clear because your PSA is generally, you're going to be under 1. As your PSA progresses up, then generally, once it starts hitting into the 2s, you're going to have to probably make a decision. And most men don't know because they're doing it through a urologist, and then it's a barbaric test. They go in and they map your prostate, and then they take 12 biopsies, and then hopefully they hit something or not hit something. I mean, it's because it's a kind of a hit and miss type deal, and it's not comfortable at all. The other thing that I would recommend, I didn't realize it till later, was you could come in and take this new MRI, and you can get a complete picture of your prostate then. And I would recommend that before I did a biopsy, because then you could diagnose where the cancer is. Then instead of going throughout the whole prostate, you could actually pinpoint where the cancer is and do that biopsy. And then you could get your Gleason score. And then if your Gleason score is 6, 7, as Dr. Busch said, 7 is the no man's land. Nobody really knows exactly what's going on in 7, but 6, you're okay. Above 7, 8, 9, you aren't okay. So you need to be prepared for that. But at 7, you need to go ahead and find out, if your Gleason score at 7, you need to remove that cancer because it is going to grow and it's going to, you don't want it to metastasize. As we all know, prostate cancer has a tendency to hide in your bones and come up, as I've seen with friends 3 years later after surgery, and their hair rears its head again. All of a sudden they got prostate cancer and no prostate. So I think men need to watch their PSA because so many men are it's questionable. Some physicians recommend it, some don't. Most men are scared because they want to know if insurance is going to pay for it, and that's a big issue on a lot of this. What good is it if you can't live to pay? Go ahead and pay for it if you aren't, because you have a life and death situation. I just said I wanted to maintain my manhood, so I'm going to go this route. And the nice thing about TULSA is that you can do it again. You can do it. Say something pops up 2 years down the road, you can do this procedure again. You aren't limited.